I'm going to go over the appointment chronological flow, which I feel is one of the most important things that we can do to make sure that we go from having new patients turn into lifelong friends. And it's really kind of the bread and butter of what makes open and affordable special, in that we are trying to create lifelong friends, we're trying to create busy practices, and we're trying to create practices that are full of our lifelong friends. I think a lot of times in new practices, we're scrambling for new patients, and in very mature practices, we're trying to create practices that are just full of people that we've known for a long time. And that's when dentistry gets super rewarding. So, I think the other thing too we that needs to be emphasized is how we're taking a new patient and getting him to be a lifelong friend. And so this section really is in conjunction with the clinical chronological flow, in that it needs to be very sequential, because if it's not sequential, you end up skipping around here, and the patient and your staff starts feeling that you really don't have basically a plan in place. I think the other thing too is if you start really focusing on this flow, it's very similar to building a house, in that all of the particular items, from a foundation to the studs to the drywall to the window to the roof, are built in the correct order in order to create a house that's going to last, or create a patient that is going to want to come back. So on this diagram up here, you can see that we start in two different ways. We start with either a new patient coming in through an emergency or a consult, and that's the appointment type that we use for all of those cases. Basically, any patient that is a new patient that has not requested a cleaning will come through that particular emergency. Okay? Any new patient that has requested a cleaning would come in through this hygiene prophy, adult new patient. Okay? So the nice thing is that when anyone in the office sees this, we know that the patient is expecting a cleaning that day. Now, that doesn't always mean that they're going to get a simple cleaning. Sometimes that means that we might do the comprehensive exam and do an SRP that day, or reschedule them for the SRP, but at least we know that they have requested a cleaning. In this instance, they have not requested a cleaning, okay? And then also, these two appointment types have been set up so that our automatic text messages go out requesting them to come in a little early and to also fill out the new patient paperwork. So one of the most important things here is that after we have addressed the chief complaint, which is really what we want to do, and we want to create an experience for the patient where we are wowing them, that the typical dental experience is, a lot of dental offices don't get a lot of new patients. So a new patient shows up, and the dentist essentially wants to upsell the patient on all of these services that the dentist thinks that they want to do. So they'll try to push a comprehensive oral exam as much as possible so that they can show the patient, hey, you've got $10,000 worth of work to do. Let me send you to the treatment plan coordinator, and we'll try to sell you on all of this dentistry that we need to do. With open and affordable, we want to de-emphasize that at the very beginning, and we want to simply address their chief complaint just as quickly as possible, and then reschedule them to a new patient to hygiene, so that the patient goes away thinking and knowing that, hey, these guys are super honest people. They addressed my chief complaint very quickly, got me out the door, and you know what? I might try them out, and the next visit is something simple. It's just a cleaning. So it's super important to now, if there is a patient who requests for you to look at more, a lot of times if the patient says, yeah, I've got a pain up here, that's my main complaint, and then I've got some chipped teeth over here, what I'm going to do is I'm going to address the chief complaint, and then I'll tell them, hey, we're gonna look at everything next visit, and we're gonna go tooth by tooth. Again, it's kind of a departure for some dentists, but we're actually trying to just solve their chief complaint and then get them into a comprehensive oral exam. Super important. So I don't usually like to go check around 3 to 4 places in the mouth. Again, it's kind of like the carrot. Hey, you're going to have every tooth looked at our next visit when we do the entire thing. Now, if there is a patient who is like, yeah, I really wanted to get cleaned up today, maybe there was a miscommunication in the front, and really they had wanted a cleaning, and so they had really should have been a hygiene prophy. But that doesn't happen in a lot of instances if your front is trained correctly. So then obviously when the patient comes back, it's a new patient to hygiene patient, which again, we don't have to worry about insurance verification. We don't have to send out the text about any new patient paperwork. We're simply just taking their bite wings, doing their comprehensive oral exam. And then on both of those scenarios, now we've kind of gotten the patients into the exact same flow here, where we're going to take care of all issues found during the comprehensive exam, and then basically just get them fixed up. And then really, when we are scheduling these types of appointments, obviously these are just for the adults, not the children, but if we could include children, if we get to them to this point, we have now a lifelong friend who is hopefully just coming in for oil changes or their maintenance visits for the rest of their life. So one of the most important things to do is to not go in a different order here and really try to address new issues, address chief complaints, and then get them into the comprehensive oral exams, then set up our appointments to take care of every little thing, and then get them to the point where they're just coming in for their recall visits. So on this little text here, obviously we need to follow the scheduling and clinical chronological protocols, which you'll see in a follow-up video. We need to be checking recall status at every appointment, and we do that in 2 ways. First of all, with the next preventative appointment being filled in or not being filled in at the on the routing sheet. Again, super important to look at that. And then with this other feature of checking on the blue dots on every appointment. Okay, again, we should be scheduling hygiene first. Just think about that. Every single time a patient comes in, just think to yourself, I want to make a lifelong friend out of this patient. I don't care about today's procedure as much as making a lifelong friend. So check the recall status at every visit and schedule that hygiene first. When we are having a patient come in for our periodic and our comp orals, make sure that we evaluate previously treatment planned items. And a lot of times what I'll simply do is like, hey, Frank, so we had talked about that filling at your last visit. Are you still thinking about that? Do you want to get it done? What do you want to do? And those are super magical words. What do you want to do? But we need to basically take every single previously treatment planned items and ask them if they do it. Occasionally I'll have people say, oh yeah, I forgot about that. We need to get that done before the end of the year. Let's do it today. Can I get it done today? And the magical words are, can I get it done today for you? Some people are like, yeah, I still want to think about it, which is fine. And then some people will say, you know what, yeah, that night guard, I don't really want it anymore. And so then what I'll ask them is, so do you want us to talk to you about it in the future? Because if so, then I'll leave it on your chart. But if you aren't interested in it ever, I'll go ahead and delete it off your chart. What do you want to do? And I'll get some people that want to leave it and some people that want to delete it, which is totally fine. Okay? It's very important to ask people about edentulous areas if they're looking to get those replaced with implants. It's very important to check wisdom teeth extraction need, meaning every single wisdom tooth that is in a late teenager or early adult's dentition, we need to obviously have it charted as existing, not missing, and then we need to say, hey, are we planning on getting it extracted or no? Okay. We need to look at unresolved perio at every exam and have that addressed by a periodontist, have those wisdom teeth removed by an oral surgeon. And then at every visit, we need to ask patients if they are interested in straightening or whitening. And that's super important. Again, I'll ask every patient, hey, especially after we have all of their general dentistry done, hey, are you interested in any straightening or whitening? And some people say yes, some people say no. On the whitening, I usually tell them about the in-office version that we have and the price, and then we also talk about the take-home kits and their price. And then if the patient is like, yeah, okay, sounds good, and I'm like, and so what I'll say to them is, okay, do you want to get that whitening scheduled? Do you want to think about it? Do you want to do one of the take-home kits? And a lot of times people will make their decision then. So again, very important to go over that every single periodic and comprehensive exam. And then again, one of the most important things is making sure the recall status is checked at every visit, and always schedule that first. So even though someone comes in and they have a broken tooth, but they're not scheduled for the next hygiene visit, what I'll do is I'll schedule their hygiene visit, and it makes patients understand and they kind of appreciate that, hey, we're not just after money. We literally want them to come in and do the best dentistry that we can do at the office, which is the hygiene visits. And yes, we'll get that tooth fixed today also. And that is literally as complicated as the formula is to obtain and maintain practices that are literally busier than we can handle. And this is just a typical day at the Bennett practice, which I've worked in for 10 years, that is very heavily focused on recall, is very focused on making sure that this appointment chronological flow is correct, and making sure that we are making lifelong friends. I can't tell you how many patients come in that I literally have known for 10 years, and many of them have fallen off, and then they come in for an emergency, and the first thing that I'm emphasizing is coming in and coming back for their hygiene visits. And then I think it builds a relationship with them that they know that I really want the best for their dentition and for them, and I'm not just here to try to make as much money off of them as possible, which is really what the goal is.